Welcome to the National Division of Public Health and Community Services, Public Health Matters. We're back in studio today with Bobbie Bagley, the Director of the Division of Public Health. And I'm Jane Goodman. I'm a communications specialist brought to the Nashville area from the CDC Foundation as part of their COVID response team. Today we're here talking first and foremost about the COVID-19 response. And I'm going to turn to Bobbie and ask her to update us on the numbers both nationally and in New Hampshire and of course right here in our Nashville area.
Yes, thank you, Jane. It's always good to keep our eyes on and continue to provide surveillance and monitoring the data that we're seeing as we continue in this pandemic event. And so I thought what I would do is start off by sharing what's happening globally. So currently right now, across the globe, we're looking at 15.5 million cases with over 634,000 deaths. So that's globally. So we're still seeing across 188 countries the activities of COVID. This pandemic event is still going on. And, and as we watch in public health, we're going to continue to provide that surveillance and watch how things are trending, across the globe because it affects us here nationally. And so our national numbers right now, we've hit the 4 million mark in the United States. And so, we want to remind folks that we need to continue to maintain our vigilance, with regards to trying to stop the spread of this viral infection. And we've had over 144,000 deaths. And in some states, we know that there's been a surge in activity because we've opened up our businesses, we've opened up opportunities for folks to go out and, again, get our economy back on track. And at the same time, because of how this virus spreads, with people engaged in communications or just gatherings, we're continuing to see an increase in the number of cases as well as the deaths. And we're also still seeing the most vulnerable populations being impacted by COVID in such a way that leads to increased hospitalizations as well as deaths. We're still fortunate in the state of New Hampshire in that as we continue to get cases, so we got a report out that we had 25 newly reported cases as of yesterday, the data that comes out from our Department of Health and Human Services, which is not a high number. It's not the same that we're seeing nationally with some states having over 200 and, over 2,500 cases per day, up to 10,000 cases per day. Some of the southern states, yeah. So, in New Hampshire, 25 is still a good number. And, with the deaths, even if they're as low as, 6, 3, 2, 1, it's still an unfortunate loss for some families, right?
Of course.
Yeah.
One death is too many.
One death is still too many, exactly. And so in New Hampshire, our epidemiologist is on vacation, so I get to run the numbers. And I think we're all sort of like closet epi people. We like to know what those numbers are.
We do like to look at graphs.
We do like to look at those graphs, right? And so even our, folks that are watching either here in Nashua or in the region, can go to these websites and can take a look on our website at www.nashua.nh.gov. We have a link to the Johns Hopkins website where we're seeing the global numbers, and we have a link to our Department of Health and Human Services data dashboard as well. And I encourage people, Jane, to look at those numbers because the numbers tell the story, right? And a lot of the response efforts that we are implementing and all the activities that we're involved in are related to the numbers that we're seeing. And so in New Hampshire, and I just happen to have I don't have a tablet, but I do have my little smartphone here to just share a little bit, in our update on these numbers here. So as I said, Department of Health and Human Services announced 25 new positive tests for COVID, and this is the data that was updated from Thursday night. And they usually do the updates in the evenings for us. And so I encourage folks to take a look at the websites. So we've seen cumulatively with the entire count, 6,318 cases diagnosed in New Hampshire. When we look at our Hillsborough County, other than Manchester and Nashua, because they report that data out separately because we're the two largest cities, there's been 6 cases in Hillsborough County, and in Manchester 8, and in Nashua 1. And so that's a nice drop for us, because on earlier, in the week, we had a report of 22 cases, and that was the highest that we'd seen in a good little while. And I'm glad that this afternoon you have Flavia Martin, who's our communicable disease nurse coordinator, who's going to talk a little bit more about what we see in Nashua and what they've been dealing with. So that's going to be important. So those are some of the numbers that we have. And we're still looking pretty good as far as the percentages for our hospitalizations, 11%. That number has been consistent for months now. Our death rate or the percentage of deaths related to COVID for New Hampshire has been 6%. That's been consistent as well. And in Nashua, we're trending around the same number, 6% for the deaths, as well as the 11% for the hospitalization rate.
So we seem to be in New Hampshire and in Nashua proportional, just smaller numbers, but in proportion with what our state is.
Exactly.
We have a small population,
yes,
but we still have 6% of those COVID cases that are ending in, unfortunately, in death. And
yes,
so that is something to be aware of, that we're not special in that area.
Exactly, exactly.
So, so that's a sobering look at how we're doing, and we are doing well. But is there some advice we can continue to give to our population? I think there's reasons that New Hampshire is doing well. Walking around Nashua, seeing a lot of people wearing their masks. Thank you for doing that, and good hand washing and social distancing. Staying 6 feet apart from people other than your family members.
Yeah, those are really important things to do. And as tiresome as this may seem for folks, it's just like, when is this going to be over? It's going to be over when we change our behaviors, and when we can be consistent with those changes in our behaviors, until we see the number go flat down, just continually all the way down. Because the virus is really dependent upon us. It's dependent upon our behaviors, and it's really dependent upon our activities to thrive and to continue to, multiply, and expose. But the things that we're doing with the hand washing, with the not touching of our eyes, our face, with the making sure we're wearing face coverings when we're out in public, social distancing, and my number one, Jane, staying home when you're sick.
Absolutely.
Those are the things that will help us continually see the numbers go down, as well as us stay where we are right now, because we are seeing so much happening across the country.
All right, so tell me, Bobbie, you're right now involved with the governor's equity response team, the health equity response team. That was, I believe it was 5 members appointed?
5 members that were appointed. Dottie Morris, who is the president of diversity over at Keene State College. Dr. Trini Tellez, who is at the Office of Health and Equity for the state. She was actually the chair. Rogers was, or is, the president of the NAACP, was also a member, and Kristen Dursey, who is at the Department of Health and Human Services. That was our 5-member team. That team was charged with taking a look at some of the disparities that we see within our racial and ethnic minority populations with regard to COVID. So that COVID equity response team looked at data that's being collected across different organizations and different agencies, how we collect that data, how that data is analyzed, and then how that data is disseminated and used to address gaps in services. And so what we see with COVID-19 is that it allowed for almost like an unveiling. A lot of the inequities that we know exist and that we have seen with certain health indicators, they've been there. They're not new. They've been there for decades. The disparities and the gaps that we've seen with hypertension, with diabetes, with cancer, heart disease.
Yes.
All of the things that we focused on with regards to the Healthy People 2020, probably 2030 now, were places where we were seeing gaps in certain population groups. In the racial and ethnic minority population groups were where we saw gaps. And so COVID hits, and it's a viral infection that for individuals that have underlying health conditions, immunocompromising situations, cancer, hypertension, diabetes, asthma, being overweight, those individuals that had those health conditions were subjected to the illness in such a way that it may be more severe for them. Could increase their hospitalization as well because their body is trying to combat these other illnesses or health diseases. And so with this task force, knowing that, you have these inequities already, COVID's really just kind of like unveiled it even, it just made it more clear.
It amplifies it really.
It amplified it. It made it even more, clear of a focus for us because you were seeing across the nation increase in the number of deaths in racial and ethnic minority population as well as disease. And so when it came to New Hampshire, our state with regards to the numbers of African Americans, Latinos, those numbers or proportions of those populations are smaller, but we saw a disproportionate rate of infection and disease and death in those population groups. And so the governor, with the request from people in the community that were really concerned about that, called for this task force to take a look at those disparities, those inequities, and to come up with some recommendations and some strategies for how we would close those gaps.
So did you come up with, just give us the highlights of what some of those preliminary recommendations are from the task force? Because from what I understood, you had a huge task to take on in about 30 days.
We had 30 days.
And I was paying attention.
You were paying attention.
So, that's not a lot of time to look
not.
at all that data, and the data comes daily. So
Right.
what are the highlights, the high-level recommendations that, the five of you presented to the governor?
So we were able to meet now. So mind you, we all also have full-time jobs. So, so we had 30 days to do that on top of our day jobs. So of course we met in the evenings and we met on the weekends, and different ones of us took on different tasks of looking at different data collections or samples that are already existing data. So we weren't looking at trying to create new data. Although we did talk about, doing a survey and continuing this work with getting more information collected from stakeholders and from people in the community. So some of the high-level recommendations that we came up with especially when we looked at our data collection right now, there are places where race and ethnicity data is not even being collected. We use the lens of the social determinants of health as well, and so there are data points where we can be collecting information that will help us identify gaps across age, race and ethnicity, across income, across disability, and we're not collecting that data consistently from agency to agency, organization to organization, or even sector to sector. So we even looked at our own data. Of course, we're going to look at Nashua's data because we've been doing our community health assessments for a number of years. And so that was one place that we went because, and I'm going to speak, mostly about the data that we collected for Nashua because I know that data well. And I can talk about our data because we can improve it, or at least our data collection. And so in looking at that, what we were able to identify and extrapolate was that we need to do better. We need to make sure that we have consistent metrics in place for collecting that data and that we can stratify the data. So in some places you would see race and ethnicity data, but then you didn't see it go across income, or you didn't see it go across disease, or you didn't see it going across what problems we're having with housing. And so, for instance, if we would look at asthma, we would want to look at, who in the population is impacted by asthma. We want to look at the ages, which we had. Then you want to go also and look at which race and ethnicity, which groups are being impacted, and are there disparities within those groups.
Right. You might even want to look at their housing situation.
You do want to look at their housing situation, right. And so that was one thing that we saw with the data. So one recommendation was, let's take a deeper dive. Let's do some things where we work together and see how we can consistently collect data the same way. Then make sure that we're also analyzing that data the same way, and then disseminating the data the same way. So we have to have some consistency with that. I mentioned that we used the social determinants of health lens, so we also looked at some of the disparities with income and earnings and opportunities for racial and ethnic minority populations to be able to advance in the workplace, or at least with COVID, if and when people had to stay at home and not work. Was there equity in the resources that were available? Did everyone know about the types of support that they could apply for? And so when the business grants or opportunities went out to apply for those business grants, there were some small businesses that were owned by people of color that didn't get that information, or that couldn't qualify for the application because they didn't have the right criteria, that their business was ran by. And so we have to take a look at how do we create systems or put things in place so that everyone has the same opportunity to apply for resources when they come. One of the other things that we looked at was, the frontline, who was identified as frontline workers. And so there were provisions that are made, which should be for frontline workers. But then we kind of forgot that some of the frontline essential workers may be people that are working in restaurants or working in some of our fast food facilities, or folks that are working like in the laundry or
the grocery stores.
Yes, the grocery store, the laundry facilities at some of our hospitals or long-term care facilities. Those are essential workers, right? And
Absolutely.
so if there are resources that are made for the frontline workers, you have to think about all the frontline workers, right? And so we looked at workforce and those types of resources. So those were some of the key things, and we had quite a bit of we had a nice chunk of recommendations that were made in the document and in the report. And the governor did thank that that's our small committee for taking the time to put forth such an exhaustive, and I can't really say exhaustive because there's more work that needs to be done.
Right.
So what we looked at it as, this is like a preliminary. It's the beginning of more work that needs to be done. And hopefully it will be available on the governor's website soon. I know that he's been talking about it in some press releases. I know that there have been some comments that have been made about the recommendations and how they're going to take a look at what are some of the lower hanging fruit things that they could address right away. And then there are things that are going to take time to work on. Anything that has to do with policy is going to take some time. That's not necessarily a low hanging fruit, but when you want to make policy initiatives, that's going to take some time. And so one of the major recommendations we made was that the governor's COVID-19 equity response task force needs to stay in place. We need to keep that going, and it needs to be a permanent fixture so that when we look at the idea of making sure the way data is collected is done consistently, you have people that are on the different committees or the commissions, right. That put those things in place. So,
and 30 days is, quite frankly, not enough to solve the problem.
Yeah, it took us 36.
Okay,
so
36. Even 36.
When we got to day 30, we were like, we're not ready yet.
So
we got to finish.
We
got to edit this document because we wanted to produce a really good document, right? We wanted the information to be credible. We wanted it to be received well. And, in reading through the final document, once we sent it out, we all read it again for the last time. We're like, wow, this is pretty good. I mean, not that we should have doubted ourselves, but when you're under that kind of crunch time.
It's a lot of pressure.
Yeah, we found one typo. Yeah.
We'll let it go.
We'll let that go. But yeah, it was a good body of work that came out of that. And I'm glad that I was chosen to be a part of that, to represent the city of Nashua, and to share what we're doing here.
So that brings us back to Nashua. If we could just look at some of the graphs we brought today to understand a little bit more of the makeup, because it does go along with this whole equity task force that you were on. We're starting with the age demographics for COVID-19, and we have just a bar graph that shows, clearly that the 65 plus population was the largest group impacted by this. But even looking at this, we realize that this is not just a disease or a virus for the elderly. And so I think that as we're reading the news and we're seeing things across the nation, and we're hearing about more and more younger people being infected. So maybe you could just speak to the numbers in Nashua a little bit.
Sure. So our graph here is actually the greater Nashua cases by age group because, and again, I love our epidemiologist, Angela Constantino. You can go on here on our Live Stories data dashboard, and you can toggle, and you can pull out, the greater Nashua, you can pull out Nashua, you can pull out Manchester, you can pull out the whole state of New Hampshire. So this is, the cases by age group for our greater Nashua, and this actually does come from our New Hampshire Electronic Disease Survey System, which we call NEDS. NEDS is a favorite term for us, the public health nurses, and Angela. But as you stated, you can see that every age group has been impacted. And one of the things that I would point out in particular is under 30, because a lot of the emphasis, as you mentioned, did focus on the older population group. and because it's a very vulnerable population group, because there are pre-existing conditions. The older we get, we know that there's going to be some things. This body, as beautiful as God made it, it's not going to last forever. And so there's some, disease things that come on to it as we get older. But if you look at that under 30, you can see these numbers start to rise up there. And right now we're starting to see increases in our numbers for those that are between the ages of 20 and 30. And you can see how that's balanced out just a little bit there. And I do believe that's because of some of the social activities that the age group is involved with. But the other thing that I would also point out is you can see we go all the way down to 0. So we've had some little ones that have come back positive as well. And, a lot has been, in the news and in the media lately on children and whether or not they, how they present with this disease. What are the concerns that we need to have with the young ones? Do they spread disease? And we do know that in family units, even if an adult is positive in that household, there's a high percentage that the rest of the family members can also be impacted, which does include the children. And some of the testing, and Jane, you've been a part of our testing clinics.
Oh, yes.
We've been testing some of those little ones, and we have seen positive results in those cases with kids. So we do know that they can be impacted by this disease, that they can come back positive. We've had some that were very ill, and we've had many that have had mild disease, but it does look like they can spread it. And so that the science is out there, the research is still being done, but we actually have some of the data that actually shows that population group, that age group is being impacted.
So, and then we have another graph where we look at race and ethnicity, and just again, because we are seeing work done more with this equity response task force, we can see even in the greater Nashua area, which we do serve, not just the city of Nashua, there are definitely more greater populations, especially Hispanic and Latino. At all of our clinics, we are very aware that we always have someone that can help translate and take registration, that can speak Spanish. So we're very aware that this population, even though they're a smaller part, they have a larger effect.
Yes, it has been impacted greatly. You can see in this particular graph here for our Latino and Hispanic group, you can see that it's up to over, I think that's over 25% are cases from the ones that we've tested that have come back positive. And I think we looked at some numbers yesterday and saw that we've done over 1,200. I think we're close to 1,200.
I think so. It's over 1,250
or 1,260 or 1,270. But 25% of those have the positive that have come back from that testing sample has been represented by a Latino population, which does not represent that high of a population group in our greater Nashua area. So there's a disproportionate representation of positive cases there. The same with our African American group here. It's at 6%, and we know that there are less than 6% of Black and African Americans in Nashua. But that again shows a disproportionate representation of cases in that population group. And so one of the things that we also recommended in the governor's equity task force team in that report, was that we would try and get more community health workers involved with this the COVID response, because as you mentioned, we have a higher number of Latinos coming in to get tested, and so we need to have that language capacity.
Absolutely.
And our staff has been doing a fantastic job, but we're small in number, right? And so we need that extra support. So one of the recommendations was to bring more community health workers on board. Dr. Tellez says we need an army of community health workers. And
well,
so,
it seems that we do.
Yeah, so we do need that extra support. And the community health workers allow for us to get closer to the community, build trust, and to make the resources and the services available to those population groups that might not have as great access to testing that we want. And we need to reach out to them more.
Well, thank you, Bobbie, for all of this information. As you know, I could probably talk to you all day long, but we have limits on our time. So just quick from Public Health, we want to remind people to be careful over the weekend and during the week. There are some high temperatures out there.
There are.
So stay inside if you need to, drink a lot of water, and be safe. And we'll be back with our one of our public health nurses, Flavia
Yes.
Martin.
Thank you, Jane. It's good to see you today and good to be here.
Take care.
Public health matters.
Hey everybody, this is Cole IE. Doing a quick PSA for the mayor's office. Wanted to make sure that everybody is staying home and staying safe. And if you need to go out, do something essential like some exercise or go grocery shopping, make sure that we're practicing good social distancing techniques. That you're staying 6 feet apart, wearing your mask, and washing your hands as much as possible. Hopefully everybody stays safe, but we can all get through this and get back to life as normal as quickly as possible.
So we're back with Public Health Matters, serving the greater Nashua area. And I'm back with a special guest today, Flavia Martin, who is a public health nurse at the Division of Public Health and Community Services. Flavia is our communicable disease specialist. So we're thrilled to have you here today, Flavia. Thank you. You have to really pinch hit today. We had our chief public health nurse call out sick. So thank you at the last minute for coming in to join us. But you've certainly been in the trenches during this whole COVID-19 pandemic. And so why don't you just tell us initially what your role is at the Public Health Department so people can understand what you've been doing.
Sure, thank you. I'm really happy to be here. I'm really excited to be here. So as you mentioned, I'm a public health nurse. There are 5 public health nurses that work for the city of Nashua. And I am the Communicable Disease Program Coordinator. So I oversee our program for all reportable diseases in Nashua and investigating all those diseases. And right now, with the pandemic going on, the focus has been really on COVID-19. And that's what all 5 public health nurses have been doing right now.
So when you say communicable diseases, because there's a lot of vocabulary in public health that we like to throw around amongst ourselves, but just to explain what communicable really means. I mean, we know that COVID you can catch from another person, but what other diseases were you working on prior to COVID?
Sure. In New Hampshire, we have over 60 reportable diseases. Yes, anything from your vaccine preventables like chickenpox and measles and whooping cough, pertussis. Tick-borne diseases are reportable like Lyme and Anaplasma, Babesia. And you have...
I don't even know what that is. You got me. You stumped me.
Yep.
Stumped the host.
Tick-borne diseases. Yep. And various other ones. And STDs, sexually transmitted diseases are reportable because we want to treat those and track those. And many other ones like botulism, Zika, some very anthrax.
Lyme
those are all.
disease would be one. Yes.
All of those are reportable. So this is.
Just want people to understand that there was life before COVID, and there will definitely be life after COVID. That your work will continue. So how has your department changed? I mean, you mentioned there were 5 of you. You're only working on COVID-19 right now. But how has that changed? Have you increased staffing? It sounds like you're working a little bit on the weekends or a lot on the weekends.
Sure, yeah. So five public health nurses. One of them is our chief public health nurse, so she handles the administrative aspect of it. 4 of us, we each were working underneath different programs. We have a very robust immunization program in Nashua where we do vaccine campaigns. We go to all the public schools and immunize children for flu. We have an STD program where we have our own clinic, and we support provider offices too, where any person that comes back positive with a sexually transmitted disease, we can treat them. We do partner services where we treat their partners as well. And we have a healthy home programs where we help children with asthma and children that have been diagnosed with elevated lead levels. So once this pandemic hit, we kind of had to shift our focus where we all started working on the COVID effort. And we are working 24/7, 7 days a week. We are literally on call, all day. We start at 7 a.m. and most of us are still working at 10, 11 o'clock at night, 7 days a week. We have been fortunate to bring on some new staff to help us, where, of course, we can't handle by ourselves the numbers that we're seeing of confirmed cases and contacts in Nashua. So we have been very fortunate to bring on. We've had a lot of people that have called us to volunteer, people that maybe have been furloughed or retired medical personnel that have called us because they want to volunteer into our efforts. So that has really been a blessing to have those folks.
And just tell me briefly, if you do want to volunteer, because it sounds like you could still use some more help. Is there a training process, or or should they just get in contact with you, and we'll put those numbers up after? But what is the process?
Yep, they can contact our Chief Public Health Nurse, Kim Bernard. And there is right now, we would take volunteers to help us with our contact monitoring. And there is an online class that somebody can do, to understand the basics of it. And then training from us as well, too, from the people that have been doing it.
So that's great.
Definitely.
That's a way, if you do want to get involved and you want to be part of this effort so that we can all get back to a new normal, that would be much appreciated by the health department.
Yep. We've also brought in some new staff. We got this amazing grant from the CDC Foundation to supply us with public health nurses. 4 nurses for a period of 6 months. So that's really a welcoming additional staffing for us to help us conduct all of the disease investigation. Because each person that comes back positive, we do have to investigate. Every person gets a personal phone call, an investigation, contact tracing, contact monitoring. It's a big combined effort.
Yeah. So let's get back to that. So tell me, we hear a lot of vocabulary. So what does it mean, contact tracing, and what is the process that you're going through each day whenever there's a new case?
Sure. Contact tracing is not something new. Contact tracing is a basic of public health. Whenever somebody has, say, a sexually transmitted disease where we need to find the contacts and notify them. If there's a measles outbreak and that you have to find those that are exposed in order to provide vaccine, same thing with whooping cough. So this isn't a new thing. But
it's just new in our ears.
Yes, yep. But we had to adapt that in order to make it COVID effective. So every person that comes back confirmed with a positive lab result, they get an interview to determine where they could have gotten it and where they could have exposed others. Where were they during their infectious period? And we do want to contact those folks. We make a list of who those folks are, and we contact them in order to monitor them for symptoms. We place them in quarantine during the incubation period, because to break that chain of infection, when you have the one positive person and then they come into contact with 3 more, if you don't break that chain of infection right there, they can go on to infect other people. And that's the role of the contact tracing and contact monitoring. So that is a lot of phone calls every single day to all the confirmed cases and all of the people on monitoring status.
So you're not just calling the confirmed cases, you're calling anyone that they've seen before and going forward once they have become infected.
Yep, during that period where they were infectious and they probably didn't know prior to getting tested, so that window of time.
Right. So you're really like disease detectives.
Yes.
With these magnifying glasses. So what are your biggest challenges conducting these investigations? Because it can't always be easy. Some people might have some trust issues, or I would imagine some people are very nervous about being told that they have a COVID positive test. So just tell me what some of the challenges are, and if there's some advice we can give to some people out there on how to be responsive.
Definitely. I think in the beginning it was a lot easier because it was all new and people were afraid, if you will. People were very receptive to this. They knew the message coming across from the news and everything, that it's here, it's in our doorsteps. And we went into the stay at home But as things have shifted, things have changed, and businesses and different things started opening back up, I think people are they have developed COVID fatigue, if you will, and they may not be as receptive to hearing that they have to stay at home when everything else is opening up. Right. So we've run into the challenge where people they may not have a lot of symptoms, they may have mild symptoms, and be saying that, I don't feel sick, why do I have to isolate? Or people that are going to gatherings and parties who are infectious and then infecting other people. Right. So we've definitely seen some increasing compliancy concerns.
And if we want to turn our attention to the graph that we brought about contacts, it really illustrates what you've been talking about, that each case has more contacts, and what you've just said is that we've started to open up. So we are having people out and about, going back to work, and socializing a little bit more, hopefully still maintaining social distance. But that being said, we can see on the graph that as our cases go up, the line that is going up pretty straight up at the far right of our graph. So if you want to just address that a little bit.
Yes, yeah. So as things started opening back up, workplaces, restaurants, and different venues that people can perhaps congregate, we are seeing a trending of each person that's confirmed, how many other contacts they're coming with. Before, it was down to maybe 1-to-1 when people were in their own homes and only were with their family unit. But as things have started opening back up, their numbers of contacts are increasing. Recently, we had one in Nashua that yielded 30 contacts. Wow. To that one person. So, you can see how if you have one person with 30 contacts, how many of those are going to, go on to develop illness, whereas if you have one person to maybe 2 contacts. Right. So that's a trend that's certainly in our radar, certainly concerning, as we've seen the trends across the other states too, with increases in cases.
And when you're talking to people and they have had additional contacts, are you asking them, are they wearing masks? Are they not wearing masks? How close the contact is, just to get an understanding of, because it is important when people go back to work, you still need to either stay in the same work pod, so to speak, or we say cohort, with the same coworkers, but still maintain those precautions of mask wearing and hand washing and those kind of things. So yeah. Are you seeing that?
Definitely, because we know from the data and the research that masks, source control mask, cloth face coverings really help and social distancing really help in terms of infection. Okay, and transmissibility. So those are part of the interview questions, because we don't want to we only want to cast our net as much as it needs to go. Mm-hmm. The one person with 30 contacts, we really have to ask the specific questions. Were those 30 people really close contacts? Mm-hmm. In our definition of close contacts, versus if you're in a workplace with 30 other people, those may not be all of your close contacts if you haven't talked to them. Mm-hmm.
So it's important. You're definitely detectives.
Part of our disease, our detective work.
So what advice do you give to someone who's been exposed or who's tested positive to COVID-19? If there is a little bit of fear, or what is the best advice? Let's start with someone who's just been exposed, not necessarily tested positive. Are you recommending that they go and get tested, or?
We are. That's very scary when somebody gets that phone call that says you have been exposed to someone with confirmed COVID-19 disease. Obviously, we don't reveal the identity of the person, but it is a scary phone call, because it's kind of, will I get sick? Will I not get sick? We do encourage everyone that's been exposed to go ahead and get tested. Okay, it can either, if it comes back positive, then we take precautions on that. And if it comes back negative, it can give a certain peace of mind. No one can test out of quarantine. And that's I
was just going to ask you
that's
that.
A very popular question.
Yeah, I was just going to say, so if I've been exposed and if I have a test, can I go back to work? Or do
You-
I still need to wait those 14 days?
You still need to wait the 14 days. And the reason for that is the incubation period of the virus in order to develop illness. It's up to 14 days. So if you get tested on day 5 and you're negative, does not mean that on day 10 you won't get sick. So the testing will give you that peace of mind, but it does not preclude you from going on to develop illness. So you still need to self-monitor, take your temperature, pay attention to signs and symptoms, but still complete the 14 days.
Yeah, so that's, that's a tough slog for some people, and understandable. It can be very stressful. And then you call them each day probably to follow up with them as well, so that
We certainly do. Yep. They get that friendly phone call from us. How are
there's
you doing
Flavia
today?
again.
Do you have any fever, cough, shortness of breath, body ache?
Yeah.
The whole slew of
Yeah,
questions.
but it's important, and by doing this, I think that the Nashville area can have maybe breathe a sigh of relief that we have such a great team working on the contact tracing and checking up on people each day and monitoring our community, and and that is the work of public health.
It certainly is. It's our community, so it's good to build that relationship with folks. When we do interact with them, we're not just asking them about COVID. We do a whole assessment with their family. During the time of isolation and quarantine, they still need to get groceries. They're going to be out of work, so those are all resources in their community. If they don't have someone, a family member that can drop off things at their doorstep, we can connect them with community resources that can help them with that. If there's a concern about loss of income during that time, we can refer them to resources in order to assist with them with that as well too. So it's really all about the community and building those relationships with people.
Right, and the connections of good health is not just health care. It's also having, food on your table and the resources that you talk about. And also, there's some stress and mental health issues that probably go along with this as well. So you're able to refer people to counseling or services that they may need in the community to kind of cope with this kind of very uncertain times.
Absolutely.
So any other advice you might have for people during this time? We need to stay vigilant, obviously. We still need to wear our masks. Flavia and I do not have our masks on right now, but we are 6 feet apart, we measured. And we will put them on as soon as we're done filming for today. So you don't need to worry about us. We are taking the proper precautions, but I think that is something that we always need to remind people to wear your mask if you're out in public. To have good hand washing, disinfect surfaces that are high touch areas. And as Bobbie said before, if you're sick, please stay home. That seems to be a really important message. Don't just fake your way through those sniffles or that sore throat or that cough. If you do not feel well, you absolutely should get in touch with a medical provider and try to arrange for a COVID test. So speaking of testing, we do have a free clinic on Thursdays that runs every Thursday from 3 o'clock to 5 o'clock. And you can call the COVID hotline at the Nashville Public Health Department, and that is 589-3456. We are doing those in the Elm Street parking garage. We've moved to hopefully a better location. We are working around some kinks of bad weather. Unfortunately, yesterday we did have to cancel our clinic due to thunder and lightning, and because the sides of the parking garage are open. So we're doing our best to hold those clinics, rain or shine. And we did have some tremendous heat also a few weeks back, which caused some concerns.
I think moving it inside hopefully will provide some of that shelter from the heat and from the elements, so that's great. Right. And we test anyone that wants to be tested. Somebody does not need to have symptoms. Somebody, if they just have never been tested before and they just want to be tested. Some people may need to get tested for work or in order to travel to. Some places are requiring that, so it's free of charge, and we test anyone who wants to come and get tested with us.
Right, so we do ask again, just call ahead so that you can have an appointment. We do a drive-through, so you stay right in your car, and we do accept walk-ups too. You don't have to be in a car, if you don't get a chance to call, but that's just an important thing that we wanted to remind folks of. And so beyond COVID, because we are opening up, we are picking up more of our public health work that was pre-COVID, and one of those things are immunization clinics. So if you just want to give us a quick blip, we do have a schedule that we could post for the immunization clinics, and if you could just tell us a little bit about how those work, and they are also free, and they are at the schools. And
Yes, yep. Well, like I mentioned earlier in the program, we have a very robust immunization program. Every year we vaccinate thousands of children and adults in the area. And right now we are focusing on, as everywhere else is reopening, we have to reopen too and start offering some of our services that we had to stop. So one of them is the immunization clinics. We're not doing that out of our building right now, as so many people have come to us in the past. We are doing it out of our mobile health van that we have.
It's a big van, you can't miss it.
Yes, very colorful, pretty stickers on the side. And so right now we do have some immunization clinics set up focusing on back to school for children. So kids that maybe have missed some of their doctor appointments recently because everything was closed down and they can't get back in on time, we certainly update the children for their vaccines. If a parent can bring in any prior vaccine records, we can certainly get them caught up to date. We also have vaccine for adults too. We're doing that out of the National Public Library right now every Wednesday, and that schedule is on our website. And another service that we reopen is our STD services, our STD clinic services. Again, we can't do those out of our building because of just, the indoor type of, but we are doing it out of our mobile health van as well, mostly on Wednesdays from the library, but we do have some Friday dates as well, every other Friday in different parts of the city.
All right, and all of this information is on our website, and you can call 589-4500. That's 4500, and you can arrange, you can check the schedule and find out when things are going on. Because it's very important that immunizations be kept up. We kind of put everything on pause, but we can't neglect our regular medical care. So it's very important now when we're in a little bit of a, I want to use the word gently, reprieve. But this is the time now to really take care of those things and get your kids immunized. And we do have back to school in whatever shape or form it's going to take, but it is coming, and you will need to be immunized in order to go back to school. So
definitely,
just make sure we do that. So any other last words of wisdom, Flavia, for us? Or
keep washing the hands and maintaining social distance. The place that we are really safest is at home. The safer at home motto.
Our mantra now.
If you will, with your own little bubble, if you need to expand that bubble a little bit. But those are proven effective ways to stay healthy. And if you do get sick, if you do start to experience new onset of anything, new onset of body ache, fatigue, runny nose, sore throat, those are all reasons to go ahead and get tested. Contact your healthcare provider, local urgent care centers, our own clinic that we run every week. All providers right now are encouraged to test everyone, even with mild symptoms. So it's better to know.
Hesitate. It's good to have too much information in this case. And I do want to say that when we talk about you're safer at home, that we really do practice what we preach. This is the first time I've met Flavia face to face. We've just been seeing each other on Zoom calls, and you do a lot of your contact tracing from home, but that's due to safety concerns, and it's still doing a tremendous amount of work. You're rolling out of bed to your laptop every morning. So we appreciate what you do, and we look forward to returning to whatever that new normal is. And thank you. Thank you for joining us, and thank you for joining us for Public Health Matters. And we'll see you next week.